Atrial fibrillation, or AFib, is the most common type of heart arrhythmia and underdiagnosed and undertreated. According to the American Heart Association, AFib affects between 2.7 and 6.1 million Americans, often leading to heart-related complications, as well as increasing the risk for stroke 5 times. Thanks for joining us for this week's Health News You Can Use. I'm Dan Cohen. During Heart Month, we're talking about AFib, how St. Luke's is leading the way in innovative treatments for those who have AFib. Joining us is Dr. Sanjay Gupta, cardiologist at St. Luke's Mid-America Heart Institute. Dr. Gupta, thanks for joining us.
Thanks for having me.
And I want to start with what atrial fibrillation is and why is it important to manage the condition if you are diagnosed with it?
Yeah, good question. As you mentioned, it is the most common heart rhythm abnormality we see. Now, it causes symptoms of fatigue and decreased stamina, but the real reason we fear it is that it can lead to blood pooling inside the heart, and that blood pooling could clot and go to the brain and cause a stroke, as well as it over time could lead to weakening of the heart, leading to congestive heart failure.
That's really good to know. What are treatment options for those who have AFib?
So typically we start with medications. Now those may be blood thinner medicines to prevent stroke, but also medications to control the heart rate and rhythm. Some patients, however, are not candidates for blood thinners because they may be prone to bleeding or frequent falls. And for them, we would use a treatment called a Watchman device, which is a little small device that goes in the heart that helps seal off the part where the blood clots form, giving them lifelong protection from having a stroke without the need for blood thinners. For patients who have symptoms of AFib that the medications are not able to control, we use a catheter ablation to target the diseased areas inside the heart and eliminate those, helping the person stay in rhythm on their own without the need for medicines long term, hopefully.
And that ties into my next question, which is St. Luke's Mid-America Heart Institute has led the way in Kansas and Missouri for pulse field ablation. Can you explain how that has evolved and helped more patients?
Yeah, we're really excited about this. This is the biggest technological advance in ablation in 20 years. What it is it's a different way of delivering the energy. We used to think of it as ablation as either burning or freezing, but now this is a catheter that delivers pulses of electrical activity that very specifically and effectively treats the heart tissue, but nothing else, and doesn't affect like the esophagus or the lungs or any structures that are around the heart. So that's what's made it really an important improvement in both efficiency and safety.
Dr. Gupta, what are some other big advancements in treatment for patients with AFib, and how has St. Luke's been leading the way in this area as well?
Great question, Dan. So for the first time, we're actually able to combine the ablation procedure along with the left atrial appendage occlusion in a single procedure. So patients can go under once and actually have both procedures done at the same time. This is really important because as pulse field ablation is an improvement in safety, we're offering it to older patients, some of them who may have other conditions that make them not a good candidate for long-term blood thinners. So we're able to now offer and combine it at a single procedure. This was studied in the option trial, which St. Luke's participated in, and it found that under patients getting an ablation, those randomized to getting a left atrial appendage occlusion procedure versus those just getting standard blood thinners did better in terms of they had reduced bleeding after the procedure, but had the same benefit, the same efficacy that the procedures had combined. And so that's really a nice thing to be able to offer our patients now.
Fantastic news for patients to know. And also, St. Luke's and Story Health launched a unique comprehensive digital health program to support patients with AFib. How's this program helping patients?
We're excited about this too. We're the first in the country to do this. What we're trying to do is provide more of a continuous wraparound experience for patients with AFib, so we can not only manage them at their visit, but also between the visit as well. And Story Health is helping us with this. We're giving patients a Fitbit, and we're giving patients a blood pressure cuff that they can use at home, and we get those readings and can manage their blood pressures and their EKG and their heart rhythm remotely, which is great. Story Health is also doing one-on-one health coaching and also providing education for these patients as well. So it's a really comprehensive experience. We're really excited about it.
That's a great resource for patients. Is there anything else you'd like to add today about AFib?
Sure. I would just patients to be more aware of their symptoms, and that if they're noticing that a decline in energy level and their fatigue, they may just not be getting older or maybe just didn't sleep well, maybe something else going on, and it could be their heart rhythm.
Well, Dr. Gupta, congratulations on leading the way in innovative treatment and care for patients with AFib, and thank you so much for joining us.
Thanks, Dan. Appreciate it.
To learn more about AFib and treatment options, visit stlukeskc.org/AFib. You can also find updates on other health news at stlukeskc.org/news. Thanks for watching Health News You Can Use.